fire extinguisher you have, you want to make sure that you know where that fire extinguisher is located in the event of a small fire. Now we will talk about how do you use the fire extinguisher properly. First, you would pull the pin that is at the top of the canister. You would pull that out. I'm not going to actually pull it out, but it's up here. Hopefully you can see it. Stand approximately 8 feet from the fire. Aim carefully at the base of the fire. You can see on the fire extinguisher, you can tell exactly where the material would come out of it. Squeeze the trigger, which is back here. If the fire looks too big while you are attempting to put it out, sound the alarm and let the firefighters handle the fire. Do not try to be a hero. Make sure that you and your fellow employees and residents and patients get out of the home or the facility. Now we will move on to back safety. Back injuries cost you and your employer a lot of time and money. Many hours at work, home, and play are lost to bad backs. It is estimated that 8 out of 10 Americans will sometime in their lifetime have a back injury. And yet, preventing back injury is very simple. We need to learn proper lifting, material handling techniques, eliminating excess body weight, strengthening neglected back muscles, so exercising is important, and adopting good posture habits. We all have a tendency to slouch down in our chair. We want to try to sit up straight. It is better for our backs. We want to be as normal curvature as we can when we're at work, home, and at play. Back injuries can also be disabling. Out of the 1.8 million disabling injuries that occur every year, approximately 25% of those injuries happen at work. For every back injury that happens on the job, more than twice as many happen at home or play. The personal pain and inconvenience that a back injury causes you cannot be measured, but we can calculate costs in dollars and cents. Back injuries cost employers approximately $6.5 billion a year, and employees then spend millions of dollars on their own just to take care of their back. Slowed production, increased turnover, medical bills, and pain. Bad backs are bad business for you and for your employer. Prevention is the best insurance to make sure that you're safe. By working together, back to back, you and your employer can prevent a back injury from happening. Keeping your back healthy and keeping you on the job requires team effort. Management is committed to helping reduce back injuries at your place of employment. Back safety is a shared responsibility. It is something that you must work together with your fellow employees on. You are the key. First step, keep your back in mind when you're going to lift something. If you think about it ahead of time and picture yourself lifting that article or that patient, do it in your head first before you actually perform that function. That way you can figure out exactly how you're going to position yourself, and when it comes time to lifting, actual lift. Lift everything twice. Do it in your head and then actually do it physically. If you think it's going to be too difficult for you to do yourself, you want to make sure that you request help from one of your other employees. There is a handout that was provided for you, and the title of that is The Anatomy of Proper Lifting. I'm going to go through with that just basically. How to lift properly. First of all, get a firm footing. Keep your feet apart, shoulder width for a stable base, and point your toes out. That way you won't topple over side to side. You'll stay stable. Bend your knees. Don't bend down at the waist. Make sure you squat down, because bending down at your waist puts too much pressure on your lower back. Keep the principles of leverage in mind. Don't do more work than you have to. Trying to lift something by leaning over and trying to pick it up is too difficult. Maintain your 3 natural curves. Tighten your stomach muscles before you lift. Abdominal muscles help to support your spine, offsetting the force of the load. That you can train these muscles to help you work. Lift with your legs. Let the powerful muscles in your legs do most of the work when you're actually lifting that item off of a floor or a table. Keep the load close to you. Don't carry something far out in front of you. Keep it close. This gives you better balance and you have better control over that load and you're less apt to topple one way or the other. Keep your back upright. Don't walk holding like this, keeping your back straight. That also will help to keep everything better for you. How to lift a patient safely is also a handout that should be included in your packet. Evaluate the weight of the patient and ask for help. It's advised that if it is difficult or if you have a heavier client, that you do ask another employee for assistance. It's safer and actually you can get the job done faster. Keep a wide base of support again while transferring a patient, keeping your feet spread apart again, shoulder width. Pivot with your feet. Do not twist your back like this. Make sure that your whole body goes at one time. Don't twist and turn. Keep the patient close to you when lifting. Use assistive devices if necessary. A gait belt, transfer board, draw sheet, a trapeze. A patient can grab onto a trapeze and actually help themselves lift over, and or mechanical lifts. Don't be afraid to use those. They may be bulky, but if a client really needs those, use that. When lifting or transferring patients, maintain your lumbar curve in your back and bend your knees again. Don't keep your knees real straight. Use teamwork. Communicate with the patient and your other staff member. Generally, when you're lifting someone, you're going to say count on 3, and then someone will count 1, 2, and then on the count of 3, you will lift. So then the lift is done simultaneously. That way, one person is not taking more of the load than the other person. Make sure your paths are safe when transferring the patient. We'll move on now to spills. What would you do if you either spilled water or some other liquid on the floor, or noticed that there was water or some other liquid on the floor? The correct answer is that you should wipe the water or the other liquid up immediately. Spills can cause slips, falls, and severe injuries, including head injuries, hips broken, knees. It can really be disabling to both workers, residents, and patients. Be careful with liquids in your facilities to make sure that you wipe up after yourself.